this lesson, we're going to look at the communication difficulties that we could face with our patients. At some point, I'm sure you're going to run across a patient that you're going to have a difficult time communicating with. So you may not speak their language, or they may have some sort of physical impairment, and you've got to find a way to communicate with them. And the first thing that we absolutely have to recognize is that it's a barrier to communication. And there's basically a breakdown in the communication path. So you have A and B. We want to go from A to B with communication. And somewhere along this, there's a disruption. And I understand it's going to be extremely frustrating, and you're going to be, oh, I'm frustrated my patient doesn't get it. And that's okay. But the thing that you need to recognize as the nurse is that you need to identify where this is happening. And in today's lesson, we're going to talk about why there are 3 things that we look at, which is input, processing, and also output. And you're gonna learn to identify, is it here, here, or here, and then you can see, is this, where in this path is it occurring, so that you can address it, and that you can figure out another way to communicate with your patient. Don't forget, communication is 2-way, right? So if your patient gets it, but they send it back to you and they can't communicate back, what's keeping you from getting it? So we're gonna look at that too. And with input, you're gonna ask yourself this single question: is there something that's literally keeping the patient from receiving the information, right? So it's a breakdown to the patient. So let's say this is the patient's ear, right? And you're going to tell them something, right? And this is the brain. And then here's your ear canal. The sound is good to the patient. Now, during this process, they have a problem getting this patient from the ear to the brain. Hearing loss, hearing impairment. These are examples of receiving information or input that's causing this breakdown of communication. And this is where their difficulty can lie. And now let's look at processing, because this is going to be the bulk of where your communication difficulties are, and probably a lot of where your frustration is going to occur. And it's okay to be frustrated, but if you can quickly figure out why your patient isn't getting it, then you can find ways to work around it. And this is literally the part where they hear what you're saying. You got your sound, right? And you're telling them stuff, and it goes from the ear to the brain, and there's a problem here. And when I say problem, there's a barrier, meaning that they cannot process what's going on, or with what you're telling them. So is there a language barrier? I had a patient one time that spoke Urdu. I do not speak Urdu. I knew of one word, and it was because the son told me what it was, and it was pain, and that's all I could really do. So I had to lean a lot on my nonverbal. Even our translator services didn't speak that particular dialect of Urdu. So language, this is a big problem. I couldn't just walk in and say, hey, tell me, how you're feeling today. Do you want to get up? Do you need to go to the bathroom? These kind of things. I couldn't do that with this patient. Education is another one, and sometimes it stems from this guy, medical terminology. If they are illiterate, if they have a low IQ, if they can't comprehend some things based on their level of education, if you speak way above him and they're down here, you're going to have a problem processing the information. Comprehension is another one, especially in pediatrics, where you have you tell a child patient to do something or to not do something, like turn your head, I need you to cough, I need you to stand up, I need you to sit down, and they're not going to comprehend it, because it's just their understanding and comprehension of language is not as developed. So sometimes it could be multifaceted. Distraction is one, especially for people that are going through grief or loss. This is a huge, huge issue. They are so distracted by how they're internalizing their feelings. They're thinking about all these other stressors, and they're just not going to understand. You're trying to tell them stuff, and they're not going to get it. And it's no fault of their own. It's just that they are distracted by it. Mental health is another one, especially for patients that are suffering from audible hallucinations. This is a particular challenge because they are literally hearing voices that you're not going to be able to hear. And if you're trying to educate them, they're going to be so distracted by it and they're not going to pay attention. So just to reiterate with this medical terminology, you're going to know a lot of knowledge, and you're going to know a lot of cool, fancy terms. But just remember that when you're talking to your patients, that you got to bring that communication down so that they understand it, or at least to their level of understanding. Hey, if your patient is a doctor, sure, then you should be able to talk without a problem. But sometimes you're just going to have to be aware of the terms you're using. The last concept we're going to talk about is output. And when we talk about output, we're talking about a patient communicating the information back to you. So we got the dude with brain, right? And you're over here. This is, they've heard the information from you. It's gone into their brain, and now they got to spit it out. And it has to go to you, right? But there's a problem in this pathway right here. There's some sort of barrier keeping the patient from getting that information back to you. So your patients that are going to do this are maybe your patients that are mute, and maybe they have a hearing deficit, so that's actually going to compound the issue. Or maybe they have like a laryngeal disease, like they had a laryngectomy. I saw tons of those when I was in trauma and surgery trauma because of like smoking diseases. They had to take up the entire larynx, so they couldn't speak. There's other diseases, like this is Stephen Hawking. He had a version of Lou Gehrig's disease, and he couldn't talk. At one point, he had a trach, and he had he had pretty significant motor deficits in his hands, and so like he would have to like look at the screen, and it could actually speak for him. So he used his computer to communicate. And so he would be a prime patient with communication difficulties. And I know that his doctors and the medical team worked well with him to give him options. And then of course, because he was brilliant, he was able to work with engineers to create this system. So where do you start as the nurse? First, you need to identify what kind of barriers that you're running into. Is it input? Is it output? Is it processing? Is it more than one? So that's like we had talked about in the last slide, that your mute patients are often deaf. So it's not uncommon to see that. And so just make sure that you identify that it's not just one singular thing, that it could be multiple. Also use the nursing process. Is this a result of disease? Is it illness? Is it injury? If you treat the disease first, will the communication go away, or communication difficulties go away, or will they get better? So also use the nursing process kind of in terms of treating your patient, also just to frankly treat your patient. The other thing you need to do is find alternatives. Maybe the only thing they can do is blink to respond. And I've seen this. I saw it a bunch, especially with your patients that had really bad neck injuries, and they had some sort of, like they were paralyzed. And the only way that they communicate is by blinking. I had to figure out that I had to ask my patients yes or no questions. And I would say like, okay, blink once for yes and two for no. And you figure out that system. And if that was the case, then you could learn to communicate with them. Hey, are you having pain? They blinked once. Okay. Blink for how many times for if your pain level is 5, blink 5 times. And they would tell me, and I could be like, okay, I know what medication to give them because I would have my sliding scale for pain. But yeah, I should say my PRNs for pain. But this is what I'm talking about. You got to find that alternative. Also, use your therapeutic communication and be appropriate for like your patients that are having audible hallucinations. Some of them are paranoid, so make sure that you're not like giggling or talking to other people at the same time, because that can heighten that sense of potential paranoia, or or it can contribute to their audible hallucinations. And so just make sure you're appropriate. Make sure that you're using your therapeutic communication tools. Find your resources. Use your other providers that are on the unit to help you, especially if you have to refer for like a mental illness professional, or if you need to find some sort of translating service is a great one, especially for your language barrier patients. Also educate. Find resources to educate them on what you know. Find the people that you need to educate them. And those education methods also usually go a long way. So today we really focused on communication, and we also focused on building up your interpersonal relationships with your patients, the ones that are going to have your communication difficulties. And also we focused on avenues of professionalism and being professional with your patients. So let's recap. First off, recognize barriers, identify these barriers early and therapeutically so that you can address them and find alternatives. Is it an input? Is it a processing, or is it an output issue? Once you identify it, then you can address it. Be sure to use your therapeutic communication to be therapeutic with your patients, educate them, make sure you're providing your resources to your patient, and most importantly, find alternatives. I can't circle this one enough times. Give your patients an option to communicate. If they can't write, then find a way for them to spell things out. If they can't speak, find alternatives for speech. If they can't, blinking is always an option. That was always my favorite one because it was easy, because I was like, hey, you can't breathe. You have a breathing tube. Just blink for me. Use your fingers. Hey, they would have a restraint. Find an alternative for your patient to communicate. That's it for our lesson on helping patients with communication difficulties. Make sure you check out all the resources attached to this lesson. Now go out and be your best selves today. And as always, happy nursing.